I am just so confused when it comes to jurisdictions wanting to embark on drug decriminalization. I just, I'm struggling to really understand what the end goal here is, what the outcomes will be. So I've chatted about British Columbia wanting to recriminalize drugs in public spaces. I've chatted about what Oregon's done, their experience, and their push to recriminalize drugs after decriminalizing drugs. And now the city of Toronto, and I've chatted about the city of Toronto, city in which I live in, that has put forward an application to the federal government for an amendment, for an amendment to the amendment. It's not the right word, but basically for the Controlled Substances Act to not apply to the city of Toronto as they look to drug decriminalization for all age groups. For all age groups. Let that sink in. We're talking hard drugs like heroin, cocaine, methamphetamines, etc. Now, I want to preface this by sharing with you what the Chief Medical Officer of the City of Toronto has said about this just today. Okay? This is a statement from Toronto's Medical Health Officer. So, this is about what's happening in BC now. I'll get to that in a second. But here's precisely what the Medical Health Officer has said. Let me start with this paragraph right here. Our application for an exemption to the federal law that criminalizes the possession of drugs for personal use was developed with a wide range of stakeholders, including individuals with lived experience. The model is evidence-informed and aims to reduce harms associated with drug use, promote and provide pathways to treatment, and does not sacrifice public safety. This is only one tool that is necessary to address the crises we currently are facing. Okay, so it's very clear. They say, they being the city of Toronto, says, by decriminalizing drugs, it aims to reduce harms associated with drug use and promote and provide pathways to treatment and does not sacrifice public safety. I'm going to pause right there. I have yet to find clear research that shows drug decriminalization reduces harms associated with drug use. Okay? So I don't believe that drug decriminalization will reduce harm associated with drug use. Meaning, I think what Dr. Devia is saying is if we decriminalize drugs, there'll be less overdoses, there'll be less needle injection injuries, there'll be less injuries resulting from toxic supply of drugs. I didn't read that necessarily, but perhaps there's a safer supply of drugs that will be provided. There'll be less of that. And maybe the logic is a lot of that is ending up in our hospitals, which can easily be solved through a decriminalization tool to use. Okay, so there would need to be clear evidence and statistics on the harms with drug use that the city should provide citizens with. That's number one. I don't necessarily believe decriminalization will address that because the evidence would need to be overwhelming for there to be a clear linkage. The reason I say that is because drug decriminalization usually involves a very small amount of possession, a few grams, etc. For drug users who have been addicted for many years, they'll blow through a few grams in no time. And so it's not relevant enough to a drug user. The second point I have, I don't truly believe that drug decriminalization will put someone on the pathway towards getting clean. I just don't believe that. Believe might be a strong word. I don't see that because in the jurisdictions that cities like Toronto and others say, well, look to Portugal, look to this, European city, look to this jurisdiction where they've tried it. There's too many confounding variables. There's too many environmental factors. There's too many other policies, culture, etc., that need to be taken into account when comparing jurisdictions, specifically when it comes to drug legal decriminalization. So Portugal is usually used as an example because they have seen a reduction in HIV, a reduction in other diseases as a result of drug use. But we also have to remember there's a series of other policies, and I think the medical health officer was getting to this, that's happening in concert. But that poses a bigger question to me. And that question is, drug decriminalization basically says the government wants more government. They want more policies. They want more control. They want more, they want more and more and more in the lives of drug addicts as a way to put drug addicts on the path towards recovery. Now, putting aside drug decriminalization, what is stopping the city right now from opening up, let's say, more homes, halfway homes, etc., more outreach centers, etc., for those addicted to drugs? I would argue there's a financial barrier, but generally there's nothing stopping the city from doing that. That precisely is what they're saying drug decriminalization will help along. But the city can do that right now without drug decriminalization. It can do that right now. And it's maybe not because of financial obligations, but it can put forward more health workers, social workers, etc., more areas for drug users to get clean and access health centers. And the city's not, again, due to budgetary issues, potentially. I'm just making that up. But the point here is that they're hiding this under the rubric of drug decriminalization. And my whole thing is, say the government does decriminalize drugs in Toronto. If we don't see a reduction immediately in drug use, in an increase in access to health services, however we measure those statistics, then that'll just prove this point that drug decriminalization actually isn't an effective tool. To the medical health officer's point, it's not an effective tool at all. It's the complete opposite of an effective tool. And so the real question the City of Toronto and other policymakers will need to wrestle with is, why are we always jumping to the most extreme policy options to achieve outcomes that right now nothing is stopping the city from doing? Drug decriminalization does not enable the city in any unique way to do outreach with drug users. Am I wrong? Am I reading this wrong? If someone out there is an expert on drug decriminalization and knows this inside out, please let me know in the comment section below, because to me, based on the examples in BC, Oregon, and other jurisdictions that have dabbled in drug decriminalization, the outcomes have been very marginal in terms of those that have accessed services and quote unquote gotten clean. Again, I don't mean to disparage anyone, but if you are addicted to drugs, it is not a one and done. I access services and suddenly I'm clean. It's like, that's not how that works. I've watched too many Wire episodes to know that's not how that works. But I'd love to know more. So let me know what you think in the comment section below. I still struggle. I don't think this is the best policy for moving forward. And I think that more Canadians should be questioning why governments are putting this forward. Let me know in the comment section below.